I was really scared. I was in despair. This cancer had come on very quickly. It was very aggressive.
But the doctor suggested I get a general scans on the plumbing just to make sure everything is okay. Those scans in about November or so of 2010 revealed kidney cancer.
I was in complete shock because I never thought I would be a person to get cancer. I've always had a very healthy lifestyle, eaten well, never smoked, exercised, no family history. So it took a while for it to really sink in.
When my oncologist told me that I don't think you're ever going to go in remission, those words had hit me tremendously, and I never felt so out of control.
Cancer does not discriminate. It affects Canadians at every stage of life, regardless of background. Billions of dollars are spent every year on research as we try to learn more about this insidious disease. While this research provides essential understanding of the disease process and helps develop effective treatments, more attention needs to be given to prevention and a whole-person approach to care. In point of fact, many cancers are preventable. Cancer treatment can be far less debilitating, and the probability of recurrence can be reduced. We are the Ottawa Integrative Cancer Centre, and we are committed to improving the quality of life of people whose lives are touched by cancer. Using a thoughtful, complementary approach, we work with individuals and families and their cancer treatment teams as they undergo conventional therapy. We also work with people seeking to prevent the recurrence of cancer and those who wish to prevent its onset. Our approach to care is based on the principles of naturopathic medicine, a distinct system of primary care that addresses the root cause of illness or disease. We use natural and non-toxic therapies, as well as lifestyle counseling, to promote health and healing. Our system of care is called complementary and integrative because we practice alongside conventional medicine in a supportive way, with the aim of a more fully integrated system of care that recognizes patients' needs as the most important.
The Ottawa Integrative Cancer Centre is a place dedicated to providing complementary and whole-person care, touching on different aspects of health, not just the physical, but also the mental, emotional, and spiritual. We're also focused on providing and researching and building on the evidence that exists around integrative oncology so that we can document the potential benefits and provide those and disseminate that information.
Integrative oncology looks at patients as a human being, not just as a tumor or a tissue. So we have to work with a multidisciplinary team. Some address on shrinking the tumor, getting the tumor out of the body. Some address on the psychological issues and spiritual issues of patients. Some address the quality of life problems. So by its very nature, many people from different disciplines have to work together and communicate well together for patients to get the best outcome.
It's not just chemotherapy or surgery or radiation or good nutrition. There are lots of other ways. And integrative oncology in particular seeks to unite that, to bring it together. That's what sets it apart. Everyone's trying to treat the whole patient, but sometimes to treat the whole patient you have to invoke other arts.
As a not-for-profit regional centre of the Canadian College of Naturopathic Medicine, the OICC bridges the gap between conventional and complementary cancer therapy and research, providing expert and compassionate care, education, and clinical and applied research.
I'm really excited about the start of the Ottawa Integrated Cancer Centre. It's allowing us to demonstrate in a very public way what naturopathic medicine and other complementary therapies can do in terms of helping people with cancer both be healthier and happier as they go through their treatment and survivorship.
Here's what we do. Our team of regulated healthcare practitioners have training in naturopathic medicine, integrative medical care, exercise and physiotherapy, acupuncture, clinical nutrition, massage and lymphedema therapy, psychiatry, family therapy, and yoga.
One of the difficult times through my therapy and through treatments was actually at the end when I was all done. because you're not seeing the doctors anymore. You're not going to the hospital every day, but you feel lost. Like, what now? You don't feel better yet. You still have all these side effects, and you still have a lot of fear about whether they got it all, is it going to come back? So fortunately for me, the OICC opened just as I came off my treatments. I learned so much about all the complementary therapies that are available, and that they would all be available here at the OICC. So it was like, oh, this is perfect.
We work with our patients to decrease the side effects of cancer treatments, including chemotherapy, radiation therapy, and surgery. We work to improve energy, well-being, and overall quality of health of our patients. We engage the body in its own healing by balancing the immune system and nourishing the mind, body, and spirit in the healing process.
There's no mistaking that chemo is really hard on the body, and I felt rotten and I felt weak. But I also know that some of the things that often happen to people going through cancer didn't happen to me, or didn't happen to the same degree because of the support of complementary cancer care. One of the things that often happens with chemo is you get mouth sores. And that can be really tough. It's painful, it's uncomfortable, and it also gets in the way of eating and drinking and taking drugs and all of that. I didn't have that. With my second chemo drug, one of the side effects can be cracked finger and toenails, and neuropathy, numbness in the hands and feet. It attacks the extremities. And I was using a powder from the naturopath called L-glutamine that you swish around in your mouth and you swallow, and it helps protect the extremities. And my nails were okay, and I didn't suffer the neuropathy.
When new patients come to our center, they are welcomed by supportive case managers who listen to and hear patients' needs and concerns. Our case managers evaluate each patient's situation and provide an overview of treatment options available at the center. Our naturopathic doctors have specialized training in cancer care and are the primary caregivers at the OICC, ensuring that all facets of each person's health are addressed, guiding and monitoring each patient through the right complementary therapies at the right time.
It's the process of applying this therapy for patients. And the OICC is providing this need. It's fulfilling a void in process of complementary alternative healthcare delivery for cancer patients.
We educate and empower people who have cancer or those attempting to prevent cancer on how to take better control of their own health. We train and educate students and healthcare practitioners about integrative oncology so that we may positively impact cancer care across Canada.
Here at the Centre, we provide a number of workshops for our cancer patients, including rejuvenation programs, complementary medicine and the role of it in cancer care, nutrition, and prevention of recurrence.
The Ottawa Integrative Cancer Centre offers really interesting opportunities for the Canadian College of Naturopathic Medicine in that we have those who have graduated from our program can do a residency here for a year or two, and those students who are in the fourth year, our internship year, can come down here for periods of externship where they get to see how we're working with the cancer patients and how we're helping improve both the quality of their life and their health outcomes.
So we want to be educating everyone, including the general public and all allied healthcare professionals. This would allow us to collaborate together, understand each other's work, and really build bridges.
We are committed to building the evidence base in integrative oncology. Our research team works to bring evidence-informed, reliable information to patients and their families. We test the effectiveness of new therapies, natural health products, and how to ensure that each patient's treatment is optimized for their needs.
Our research agenda really is focused on two types of research. One is the conduct of specific randomized trials on promising natural therapies. And the other is on looking at the whole system of care that's provided within a setting like this that is integrative.
One of the things that we're both passionate about as organizations is research. Let's learn more. Let's find out how we can be even more powerful in the fight for cancer survivorship. Research here makes this center unique. the work that's being done here in a clinical trials type of environment is learning and is going to benefit the next person. So I think it makes OICC quite exceptional.
My brother and I do research together to evaluate if melatonin will prevent lung cancer recurrence in patients who've had resected lung cancer. First study of its kind in the world, multi-center, running in multiple centers across Canada. Melatonin has been shown to extend life in patients who don't have resectable disease, their advanced disease, and so we're evaluating if it can prevent lung cancer recurrence.
The OICC is breaking new ground as the first integrative oncology and research center in Eastern Canada. Over half of all people living with cancer embrace complementary therapies but often don't talk about these choices with their oncologist. To help patients get the best from complementary care alongside conventional treatments, we communicate directly with medical and radiation oncologists and surgeons. This collaboration makes it much easier for patients to cope with treatment-associated toxicity and side effects.
By working on a model that enables better communication between our center and the different healthcare practitioners that are involved in someone's care, what we're trying to do is to break down some of the barriers that exist.
It's about time that we looked at complementary and alternative therapies and practitioners as part of the healthcare process and system. It's absolutely exciting for me as a practitioner of conventional oncology to have this option for patients to consider.
More and more patients today are seeking complementary therapies that support conventional medicine, and we help to provide information throughout the cancer community.
So there's a lot of players that are involved, including the institutional ones at the hospital, and including the Ottawa Regional Cancer Foundation, as well as the Ottawa General Hospital, that are trying to meet the needs of patients. So we're fitting in very well locally within that framework. And then nationally, we see ourselves as trying to establish a model of care that can be replicated across Canada.
We're the beacons standing up saying, absolutely, there's something you can do, and come here. You know, we're going to help you. We're that hand that's going to guide you. And you know, in the very little time that we've actually existed as organizations, we're changing lives.
The goal of the Ottawa Integrative Cancer Centre is to improve quality of life at any stage during the journey through cancer and, if possible, to extend life. As we continue to grow, we are committed to helping our patients achieve the best level of care available through an integrative approach that is professional, compassionate, safe, and effective, and that meets the unique needs of each patient in our care. This is our commitment to you.
I knew that we would be filling a gap here in terms of the care that we're providing, but until I was living it day by day, I didn't realize the enormously positive impact we would be having on our patients. And as our patients' stories unfold, we're really weaving together a place of health and healing.
Well, I still come to the OICC. I see the nutritionist because now I'm all about preventing a recurrence. So the nutritionist helps me with the kind of diet that we should have in our family. I see the naturopath doctor here, so she's helping with supplements because I still have lingering side effects, so she's helping me with those and also with recurrence as well. And I also see massage therapist who helps me where I had surgery. There's a lot of scar tissue and still have issues there. So yeah, so I'm moving through all that and getting my body healthy again.
The Ottawa Integrative Cancer Centre has been an integral part of my healing journey. I love having some of that control back.
I remember just being kind of almost elated emotionally that, you know, there was something in Ottawa that would help me.
I feel so fortunate that I was able to encounter what complementary medicine had to offer very early in my cancer journey. It's been an incredible journey of straddling both systems, and I feel getting the most out of both, what each had to offer.